Hi everybody, I'm Rohit. I'm a graduate of the Bachelor of Science in Public Health from all the way back in 2016. So what brought me initially to public health was my deep interest in healthcare subjects and healthcare matters. When I was preparing for the interview, as I remember, for the School of Public Health, I was exploring all these different kinds of healthcare topics, and it just made me realize how broad-based health actually is, in the sense how these problems actually affect people. It's not just about a pathology, it's not just about a microbiological cause, rather it is about how problems affect people. And that's what allowed me to demonstrate my deep interest in public health back then. So the School of Public Health provides an excellent bachelor program. Of course, as we all know, public health is now one of the hottest topics and the hottest subjects that we're discussing actively. It's not just about, the SARS pandemic back in 2003 or swine flu, which again, Hong Kong found itself in the epicenter of. COVID-19 has really made public health into a very, very important aspect of our daily life. It's not just disease, as I mentioned. Public health, or health in itself, is not merely the absence of disease or infirmity. It's about how problems affect people in all ways of life. AI, big data, all of these things are part of public health. And so public health remains a very interesting area for all of us to study and learn about. For me specifically, coming from an ethnic minority background, adjusting to school life in public health required that, of course, I pick up a bit of the regular Cantonese, but the program was otherwise very smooth for me to go through. I still remember at the very beginning, when I was still thinking about whether or not I wanted to do public health, one of my mentors in life, Professor Martin Wong, actually told me to think about what really made me happy and passionate to do. So really, for secondary school students that are interested in pursuing public health or medicine, I have 3 pieces of advice for you guys. Number 1, be brave. Find what makes you passionate. Find ways to change the world. Number 2, do what makes you and people around you smile. Learn how to add value to people's lives. And lastly, number 3, build your passion into perfection. Of course, that's our school's motto as well. So, coming from my background in the past, well, not the past, but in the 3 years that I had in the school, I had some of the most amazing experiences, and I was involved in a lot of things, and I continue to be involved in a lot of things with the school. So outside of my studies, I was also involved in teaching juniors PASS, which is what we call peer-assisted study sessions. So basically, I would go back and I would help my juniors with statistics in my case. And so this not allowed me only to build a great understanding of the knowledge and develop myself further, because honestly, as teachers, we learn from our students, but also allowed me to build great relationships with some of my juniors and allow me to find myself as who I am, as potentially someone who teaches students in the future. Other than PASS, I was also involved a lot of things outside of the classroom. So I did a lot of TED Talks during my time in CUHK, both inside CUHK and outside, and I actually still do that to this day. I mean, it's always made me interested, and I think public health has been a conduit for me to really get in touch with people's stories, and this deep fascination to bring them out and share them with other people in the audience. So, if you were to ask me what's the proudest moment that I had during my years at the school, it might be the time where I was awarded the Sir Run Run Shaw Gold Medal for my college. Also, of course, academic achievements, but definitely looking back, I think when I graduated and I officially became the first ethnic minority postgraduate student to study medicine in Hong Kong. I didn't know that was the case, but when I was told about it, when I found out about it, that was definitely a great feeling to have. And really, I want to thank all of my professors, all of my mentors, not just within the School of Public Health, but from my fieldwork attachments in Pfizer, and everyone for really guiding me through my 3 years here. I was always someone that actively looked for feedback, actively looked to get better at what they were doing. And I hope that my teachers saw that in me, and they really, really encouraged me to bring out my passion. Towards the end of my studies in public health, I actually helped to co-found an NGO, which is something we applied to CUHK for funding for. And so I felt all of my training, everything that I learned about in public health, be it when it comes to data analysis, understanding epidemiological trends, advocating for my patients, which is something I hope I'm still able to do today as a doctor, really came to fruition because our NGO was for ethnic minority youths, which is a topic that is very, very close and personal to me. So I hope that listening to my story, you guys can be motivated to consider a career in healthcare and medicine. Medicine is not just about directly caring for a patient anymore. It's become a very broad topic, especially in our century, in our era. So I hope you guys can appreciate that from my story. So for those of you that are going to be joining us at the School of Public Health coming this fall, I just wanted to extend a warm welcome to you. I hope to see you guys on campus and in the future because I continue to be involved with the Alumni Association. So I hope to see you at our gatherings in the future. Thank you for joining us and see you soon.